Hi, it's Dr. Arif Rajpura here, Director of Public Health for Blackpool Council, here to give you an update again on the coronavirus pandemic and how it's affecting Blackpool. I'm pleased to say that since the last week of October and up to this point now, we've seen a continual decline in cases, which is really positive, and other areas of the northwest are seeing similar sorts of declines. However, what I must say is that cases are still too high, and we need to get them much lower than where they are now. So please do everything you can to support what we're doing, which is, of course, when you're outside of your household bubble, then you need to maintain social distancing, wash your hands regularly when you're out and about, or use the alcohol gel, wear a face covering where it's mandated, and of course, if you're symptomatic, you have to get tested, and that's really, really important. And we ask that everyone that's got symptoms of high temperature or a new continuous cough or a loss of smell or taste gets tested, and you can go through the website to get tested, or ring 119. There is plenty of testing capacity in Blackpool, so we have a fixed site now, which is at the end of Yeadon Way on the South Shore car park there behind the petrol station, and there's plenty of capacity there, so people can go there. It is a walk-in site, so you can drive there, park up, and then walk to the site. So please, if you're symptomatic, go and get a test. The other positive news, I guess, we've had over the last week or so is vaccinations, and vaccination programs for COVID will hopefully start shortly, and the NHS is gearing up to deliver the vaccination program from December onwards. Initially, the program will be targeted at the most vulnerable, so the care home staff, frontline healthcare workers, and of course people over the age of 80 initially. It will then get rolled out to the wider population, starting with the older age groups in due course. So that's a really positive development, and we look forward to a wider rollout in due course. Thank you for everything that you've been doing so far, and particularly with keeping children in education. Now, education is really important, and the risk to young people is low, and we want to make sure that we keep as many children in school as possible. So parents and carers in Blackpool, please, if you could make sure your children keep attending nursery and school. And of course, if they're symptomatic or they're unwell, then do keep them off and get them tested. And of course, some will have to self-isolate because the class bubble may have had a positive case. So in those instances, of course, the school will provide alternative learning routes through online mechanisms. But with other children, since the summer, schools have done an amazing job in making sure that they've got all the protective measures in place, that the COVID secure, to welcome children back in a safe way. So if it just finally leaves me to say, I'm really grateful for what people have done in Blackpool. It's been great that we've not seen the levels in some other parts of the country, and so I am extremely grateful that people have followed the advice. Please keep following the advice. Let's get through this winter. I think this winter's going to be challenging, and that means up until springtime. The seasons are against us. This virus spreads better during the winter months. So let's be really careful over the winter months. Let's get to spring. Hopefully, in the meantime, we'll get as many people vaccinated, depending on vaccine supplies, as possible. And then, we can look forward to some sort of normality next year. So thanks once again for listening, and I'll hopefully see you next week on the next call. Thank you.